Welcome back to Duffy Chats. Today we're joined by Dr. Gigi Kroll, a local trusted OB/GYN with more than 2 decades in private practice.
In 2025, she transitioned her care to focus on gynecology, menopause, medical weight management, and a more personalized model for patients.
Dr. Kroll, welcome aboard. We're thrilled to have you join us today.
So welcome, Dr. Kroll.
Thank you.
After 25 years in your practice, you've made a quick change to it. And can you tell us more about the current change and what prompted you to do that?
Yeah, absolutely. So I've been in practice in Newport going on 26 years now. But in that time, I personally went through my own perimenopause and menopause transition. Many of my patients have grown with me. And what I realized is we're really good about taking care of women through their pre-childbearing, childbearing, maybe fertility years. And then it's a black hole. And we really don't teach them about what is coming as hormones decline, some of the things they might experience, offer support, offer treatments. And I wanted to do that more wholly. So gave up the OB thing, got to deliver babies for 25 years, and it was wonderful, but it really frees up time that is necessary at this stage of life.
And you went to a concierge model, I think a little bit earlier than when you made this transition, but can you talk to us about that? And then also we actually do get questions from people about the insurance component in conjunction with that model.
Sure. Many physicians are finding different business models. You know, again, being in practice for so long, I have seen how medicine has really changed. 25 years ago, insurance reimbursements kind of paid enough that you could also pay your rent, pay your overhead, but those have not increased at all in the same way inflation has. Mm-hmm. So physicians have to see more and more patients. The visits get shorter. Yeah. Many practices could not stay open, so they are either purchased by a hospital model or private equity, and so they don't have a lot of control about their schedules, how many people they see, and things are impacted. It's hard to get an appointment.
Oh, yeah,
just even to make an appointment. So the idea, which many primary care docs started with in terms of concierge, is to limit your panel of patients, have more time with them, make yourself available. They can get through to the office for urgent same-day needs, even for emergency after-hour weekends. You know, really have accessibility and develop that relationship to have continuity and able to get in. To be able to do that, we charge a concierge fee. Okay. And that fee is essentially a membership. And you then get access. We provide, in my practice, a cell number you can reach during the day and a separate one night and weekends. We spend an hour at our first initial visits. We have prolonged visits. We try to stay on time. We also try to keep it super convenient. That's another issue. If you go to see a typical physician, they might give you a lab slip for to get your blood drawn. Now you have to make an appointment at that lab, and they might send you somewhere for an ultrasound. We have a lab in the office. We have an ultrasound service in the office. So it's trying to make it a higher level of service, better care, accessibility. Now, I am contracted with PPO insurance. So when I do a medical procedure, I see a patient, you know, and see them for their annual exam, provide the medical service, I'll still bill the insurance for the medical care that we provide. I operate on patients, I do outpatient surgery, I will bill the insurance for that.
Labs too, right?
Labs too, pap smear, you know, biopsies, etc. So it's nice you're utilizing the insurance that you're paying for, which you need, because you certainly need that. Especially if you have something more catastrophic, hospitalization, etc. But you're essentially paying a membership fee
for access
and availability, and having that resource for you,
and quality of care, just because you can spend more time.
It's
get in.
It's better for the doctor, honestly. You know, and it's I think a better experience for the patient for sure.
Yeah, sounds good.
I feel like menopause is getting a lot of attention that it hasn't in the
past. Finally, right? It's about time.
Perimenopause and menopause, I agree. I'm in that season. Yes. Why do you think it didn't get the attention before? And and then moving forward, like what other things are, you know, like I know you have a conference coming up being done to educate women, I guess?
Sure, yeah. No, that's a great question, and it probably has multifactorial in terms of the answers to that. First of all, menopause is not taught in medical schools, and it's not taught in most residencies. So most physicians actually get no education on it, so that's a problem.
Yeah.
Women's health care is underfunded. Then we go back to the Women's Health Initiative study. That was an exciting study at the time because we were actually getting a study on women's health, but it was actually looking at whether or not hormone therapy could prevent heart disease. The design of the study had a lot of flaws. That's too much to cover today.
Yeah.
But ultimately, it hit the headlines back in 2002, stating that hormone therapy increased the risk of breast cancer.
Yeah.
Right.
And it just kind of blew up the way media can
Yes.
blow things up. In hindsight, the WHI has retracted that. It actually showed no evidence. We have lots of safety evidence now. We use bioidentical hormones. Things have come a long way. But that event put another huge halt on menopause just even being addressed.
Yes.
So currently, what I think has changed is a couple things. Women are smart. We're not willing to just put things under the rug.
Yeah.
Right.
Social media and access to information
Yes.
has increased greatly since the development of the internet, the iPhone, and a bunch of other platforms. And we recently had the lifting of the FDA's black box warning on estrogen products.
Okay.
And that is huge.
Because of what they said was the risk to
study.
cancer?
Yeah.
Because
Correct.
of that?
So
Okay.
after that WHI study, the FDA put a black box warning on estrogen products, saying this could increase your risk of blood clot, stroke, breast cancer. Even on vaginal estrogen, which we know does not even get into your bloodstream. So you have a patient pick up their prescription, maybe she's 60 and she's getting recurrent bladder infections. We know vaginal estrogen will reduce that, but she sees this black box warning and she throws the whole thing in the trash and won't do it.
Okay.
So there's been so much safety data and evidence. There's been a number of physicians, scientists, advocates who have petitioned the FDA. We finally had the audience. They looked at it, and that was repealed a few weeks ago.
Oh, wow.
Yeah.
Okay.
And I think that's going to be I think that's going to be a great game changer, remove barrier to care, but also instigate more research and investigation in this area.
So you became menopause certified certified practitioner, if I'm saying that right.
Right.
How long has that been around to get that certification, and then tell us about your journey with that.
No, that's great. So there's an organization, and they're kind of considered the leaders in menopause medicine in the United States and in Canada. They used to be called the North American Menopause Society. They rebranded as the Menopause Society, and they were started in the, I believe, late 90s, maybe early 2000s.
Okay.
So they've been around for a couple
while.
decades. They have a monthly journal called Climacteric where they look at research from all fields and, present that data. They hold a national meeting. They provide a lot of educational platforms on their website, both for patients and for clinicians. And then they offer an exam that you can take to become a certified menopause provider. It's a 3-hour exam.
Wow.
You do need to study.
Wow.
But it's very rigorous in that they, really want you to be qualified. And then you need to maintain your education to remain a certified practitioner as well.
Okay.
So on to further that, so that's a piece of education that you didn't have back when. Like you were saying, it's not offered as part of your medical schooling and all that. So what else can doctors like you do beyond that to help yourselves gain the knowledge?
Sure. Well, certainly there are plenty of different journals. There are plenty of books that you can read. There are plenty of other organizations. Another one that I joined is called it's called ISHWISH, but it's the International Society for the Study of Women's Sexual Health. So women's sexual health falls into a crossover with hormones. Often major complications or changes happen as a woman ages. So there's many organizations that do crossover.
Okay.
And truly menopause should be taught to every specialist that takes care of women.
Yes.
So are you going to spearhead that with your colleagues?
And that's the goal, know. And I think even organizations like Hoag Hospital has begun a midlife women's monthly gathering for people, physicians, clinicians that are interested in learning more to bring it to their practice. And they've had speakers that are gastroenterologists, cardiologists, what are some of the others? Psychiatrists, breast cancer surgeons,
all different.
Exactly, sexual health experts, etc. Because if you think about it, one of the complications of menopause can be joint pain or frozen shoulder.
Yes.
Our orthopedic colleagues need to know about that.
Got
you know,
it.
Another symptom could be palpitations. Our cardiologists need to know about that. So it really is an area where we are not little men. And we need our own understanding of how our bodies transition and what we can do to thrive.
And what is one of the biggest misconceptions that you think
that we
have about menopause?
Yeah. Well, I think that what I've said about how far we've come is good, but I still think that a lot of women are afraid of hormone therapy, and risks associated with it.
Yes.
I think a misconception is to say that this is natural and I'm going to age naturally. In the reality, menopause is a relatively new phenomenon. You know, the average lifespan for women in 1850 was 40 years old.
Oh, interesting.
Right?
Okay.
Longer now.
Oh, well, that makes sense. Okay.
Right?
So there was no reason to even, you wouldn't have had this.
Right. Yeah. And even if you take mammals in the animal species, most die in the wild when they hit, towards the end of their reproduction. So they don't experience menopause.
Okay.
But if you take these mammals and you put them in a artificial environment where they're not being preyed upon and they're not experiencing famine, they're going to live longer and they are going to experience that. So that's kind of a misconception in a way to say it's natural, because you could also say, well, if we want to go natural, then we're not going to take antibiotics and we're not going to do vaccines and we're not going to do all these other things, right? So it's an interesting kind of point to make.
That is a big point to make.
Yeah, and kind of interesting misconception, I believe, too.
What is like the most interesting? I know I read, I don't know if this is true or not, social media.
Sure.
Yeah, that's the hard
like
thing.
one of the things, because I'm in my perimenopause journey, it was like phantom smells. I was like, phantom smells. Or like, what are like the most odd symptoms that you can have during perimenopause or menopause?
I think we're still learning, you know, and this is coming from, really trying to gather data for women experiencing. But I think some of the things that surprise women is dry eyes.
Oh, yeah.
That can be really...
Oh, that's part of it?
That can be part of it. I know, dry eyes. Itchy ears.
Oh, yeah.
There's a whole explanation for it, but itchy ears. Certainly, I would say, things that surprise women is that beginning of the hair loss.
Yes.
A lot come in and they don't realize they're having hair loss, and they're like, well, check that. Of course, you should check all labs, thyroid, iron, ferritin, etc. But when everything kind of pans out, that can be a common symptom related to that. So there's quite a few, really hormone change can affect every organ system. And what affects one person can be very different than what affects another, right? Yes.
But so let's say you had the dry eye or one of these other things that you wouldn't necessarily, the general population is probably not going to think, oh, menopause. Probably. So they're going to go to whichever doctor they would normally see for those things. And that doctor may not know or may never tell them that would be associated with it. So if you were to treat the menopause part of it with the hormone therapy, could that help those things?
Yes, absolutely.
Interesting.
Yes.
Okay.
Now, I want to be careful to state that we don't ignore a workup of other things.
Okay.
But for instance, we know there's a huge increase in anxiety and depression as women experience perimenopause and menopause. And there's definitely a place for psychotherapy and serotonin reuptake inhibitors, and they're very helpful tools. But we don't want to ignore that hormone decline may be a precipitator.
Okay.
And so adding that or making sure that is part of the conversation, I think is very important.
So that they may be on this other thing too, but as this is improving, maybe they're able to not take that thing over here.
Just the dry eye one comes to mind. I have a patient who was, I can't remember what the name of the drop was, but she was getting a very expensive
I can't
drop.
think of it, but I know it's
$1,000.
I feel like everybody's on it. It seems like.
And we put her on hormone therapy, which was appropriate for her. And she came back, and one of the funnest things was she's like, I don't need to use the drops anymore. I was like,
So she stopped using them to see how she was doing, and then
she was doing well with them. Starting the hormone therapy, was doing well. didn't fill her prescription, so it just kind of fell in this opportunity where she had to trial off, and then she's like, I don't need them anymore. So, you know, I didn't tell her to go off of them. It was just one of those
things. She figured it out on her own. And then I know you offer different things at your practice we'll get into aside from the gynecology sector and then the hormone therapy, but also the weight management, which can be attributed to the hormone issues as well. Can you talk about that?
Absolutely. Yeah, no, I'm very passionate about helping patients, and men and women we have in that portion of our practice. We kind of have a sub-practice that we call Get Slimly. Patients can buy kind of a subscription or packages, because weight management, I think we, as physicians, again, our clinicians, don't get trained on very well, and we don't have the time and energy to offer the correct support. But what we have dug into is really trying to understand and support the patient, help them feel like they're not a failure, it's not their fault. The complex change just related to perimenopause in terms of your hunger hormones, your sleep patterns, all of that affects how you distribute fat and hang on to it. So our weight management program goes into education. We are big on body composition analysis, which is huge, because the weight on the scale, which so many women have been taught to look at, is only one piece. What we want to look at is what is their skeletal muscle mass, because muscle is your money in the bank in terms of longevity. And we want to look at their visceral fat, which is their risk factor fat, is what puts you more at risk of metabolic disease. And we want to look at their peripheral fat. And then we help them figure out what goals they want to get to, and we teach them that losing muscle while on weight loss medications is not necessarily making them healthier. So we teach them how to maintain or even grow muscle. Those patients make us super excited, and that's actually what's going to help their peripheral fat go down. We incorporate medications as well as I don't want to say dietary, but nutrition guidance, so that they understand how much protein they should be taking in, so that they don't lose muscle. And we hold them accountable. And we give them support. And we use the medications and teach them how to take them without getting the negative side effects. So, you know, these GLP-1 medications, and we're going to continue to see more and more of these in 2026, are one of the best game changers for their health in the United States and the world. But exactly, if you're not monitoring composition, learning how to eat, learning how to lift and build muscle, and the whole rest of it is not necessarily working to make you healthier.
And I'm sure, I mean, you can see that around, you know, you can kind of tell, unfortunately.
Well, you can get skinny shots at a hydration room, and I'm not calling anything out, but there's a lot of compounding, and there's not a lot of training behind this, because, of course, anything that is one, going to give you quick results, and two, is a money-making business. Those things are going to, you know, drive that consumer demand.
Go ahead.
I want to say, is that the same thing as a peptide? I keep on seeing all these peptide. What?
Yes. Okay.
I was like, why? I'm just confused.
There's a lot going on.
Let's break this down. Okay. So you're confused like so many others, but the term peptide simply means a very small protein. So kind of back to your biology, you know, back in the high school AP bio, proteins are made of amino acids. And a peptide is a protein that has only about 8 to 16 amino acids. It's a small protein, Other proteins are huge and complex. So that term peptide, that's what it's referring to, Now, semaglutide, which is Wegovy Ozempic, is a peptide. And that little protein binds to receptors. So it's also a hormone. Anything that binds to a receptor to initiate a response is a hormone. So when you hear the term peptide, it's a small protein. But there is a non-regulated, many compounding pharmacies that are making a semaglutide peptide or tirzepatide peptide. That's not the name brand FDA regulated. And so they'll use that terminology. There's lots of other peptides that they will sell too that may enhance recovery, function, etc.
But they could be called, they're still a peptide. They're just a different type of peptide.
Yeah, exactly.
Yeah. I'm seeing people
Wegovy is a
this,
peptide,
combine that.
and Ozempic is a peptide,
Yeah.
and Zepbound's a peptide. Yes.
Okay.
So it's like there's so much information available to us now, but at the same time, it's also very confusing because there is so much
overwhelming.
information.
You need
And you get it from all over the place, and you don't know what to believe, what not to believe. There's discrepancies. That's challenging for the regular person out there.
Right. And marketing, I'm sure your phone is listening to you right now, and you're going to get all kinds of things coming in after this conversation, right?
Yes.
So they hear you, and then you're going to start getting all of this information. And, I tell patients to be very discerning. We are, when you are not feeling well, and also we're at a stage of life where we generally have income. We are a really vulnerable market.
Yes.
And if something claims to be too good to be true, it probably is. And if it's not regulated, you can claim anything. Okay. Right. So the FDA requires very extensive testing. You have to pass those tests, show in stage 1, 2, 3 clinical trials. It's extremely expensive to do, but then once something becomes FDA approved, you will always get the same thing, same dose, highly regulated. You know what's in there. Mm-hmm. Whereas if something is unregulated, it's compounded, it's made on a non-regulated pharmacy, you don't know.
You don't know what you're getting,
So be careful, you know. I'm not saying that there's anything wrong with it, and we use compounding pharmacies for a variety of things, but I think it is really start there when you're confused and kind of go, okay, what kind of testing has been done? Is it regulated, et cetera? What's the safety profile?
What's the average age that someone should come in and start seeing you? Because
every year for your annual exam.
Well, no, I'm saying for like the menopause and perimenopause. How do you differentiate with like I'm just a little off, or it's something to allergies, or it's something to something else? What should be like the big bright light bulb to be like, okay,
when you feel terrible, when you feel crappy,
right? Or ideally before that, it's a great question, and honestly, my goal, my dream, my hope would be that our education improves so much that a woman will know what to expect is coming. Understand what tools are available to her, and then be able to self-advocate for that. And an analogy I use a lot with my patients, especially if you have a daughter, or us women, we've all went through our puberty ourselves, is that we spend a lot of time between birds and the bees classes, books, gatherings at school. It's in our curriculum to teach our young daughters, okay, you're 10 years old. We need to talk about the fact that at some point you're going to have hair growing under your arms, and your breasts are going to get bigger and be tender, and you're going to get acne, and you're going to start to get moody. And once a month, blood's going to come from your vagina. Okay? Now think about it. If you never were told that, how scary would that be, right? If you didn't understand that this was normal and that you might have worse cramps than another, but we can help you. So if by age 35, every woman understood, okay, I'm moving into the perimenopause era. These are things that I might experience, either physical symptoms, cognitive symptoms, mood changes, or genitourinary sexual health symptoms. I kind of know where to go, what might be contributing to that, and seek that care.
Is there, on the reverse side, is there an age where it's too late?
That is a good question. I think when you're saying, is it too late? It's never too late to optimize your health care. So if I see a patient, let's say she's 58 years old, her last period was 8 years ago, she was never on hormone therapy. She comes in and says, did I miss my window? Is this something I should do? I'm going to look at her very individually. I'm going to look and see, 1, are you having symptoms? And then 2, I'm going to look at her health and her potential risks, and specifically her bone health at that point. Because if she has bone loss, which many will, the FDA has actually indicated estrogen therapy is one of the primary preventions of further bone loss. Okay. Now we're also going to weigh that against potential risks. The only true contraindication is bleeding that's not diagnosed, or an active cancer that's estrogen or progesterone receptor positive. I'm going to talk to her about vaginal estrogen. I think that's very, very huge to bring up in a woman as they continue to age. It will help prevent recurrent bladder infections and urosepsis, which puts women in the hospital and costs billions of dollars to Medicare every year.
Wow.
So we're going to talk about all those things and kind of do our own risk-benefit analysis and decide whether she may benefit from some low-dose hormone therapy.
And are these things that then you could potentially be on for the remainder of your life if you want to and you're able to?
Absolutely.
Okay.
You know, there's been also an evolution in the knowledge and the data that we've been gathering, kind of coming out of that Women's Health Initiative study, where, by the way, they used oral estrogen, which we know increases risk of blood clots, therefore increases risk of stroke because it gets metabolized through the liver. Same thing with birth control pills. That's why we screen to make sure women aren't smoking and older on them. Transdermal, meaning through the skin, estrogen doesn't have that same risk.
Okay.
So this Women's Health Initiative study used oral estrogen. It was conjugated equine estrogen, so it wasn't bioidentical. And it used a synthetic progestin, which was called medroxyprogesterone acetate, also oral. And that binded to the receptors really strongly. We now use bioidentical hormone therapy. It looks exactly like what your body makes. And that data really does not show any increased risk with prolonged use at this time. So the old party line used to be lowest amount for shortest period of time. That's really old information. And now it's what relieves symptoms, has been proven to give benefit in terms of dosage related to bone, retention, et cetera. And as long as the patient's tolerating it and they're doing well, there isn't an endpoint.
Now with your newly reimagined, gorgeous office,
Thank you.
Everyone has to go see it. Tell us about some of the other things we talked about. What you're doing, and then obviously the hormone, like we said, the gynecology, the hormone, weight loss, and I know you have other things. Talk about, and you have someone you know very well who's also joined your practice. If you could talk
one of the
about
things that we do is, I ask patients to sign up for the year. And the idea would be when you get to know a patient, they might continue to sign up year after year, just like with a primary care doc. So as much as a primary care doc offers the general primary preventative care, I also provide that too. Okay. I just have this added level of specialization in terms of women's health, menopause, gynecology. I always do tell patients I know a little more about primary care than your average gynecologist because I'm married to an internal medicine doc. We've been married for 31 years, and Dr. Doug McConaughey. So there's a lot of dinner conversations about things. Can you help me with these labs? And he has actually started a concierge practice as well, seeing patients in our same beautiful office. So we've got that wonderful curbside and kind of some of the extra primary care, amenities from, cryo freezing, if you've got something you want to take off, EKG services, etc. Screening for, if you have the flu, if you have need IV therapy, etc. So primary care is part of it. Dr. McConaughey, great for the men in the community that want to have that level of service. So that's one thing. I also this year essentially collaborated with Jennifer Muller, who started her own business called Skinwise Aesthetics. And we have known each other for almost 20 years.
Oh, wow.
She'll let me say this. I delivered her babies, so there's that. And we've, referred patients for years. She's just a wonderful human being on top of a very excellent clinician. She's interested in what we call regenerative aesthetics, a lot of ways to just keep the skin healthy, help women feel that they're maintaining, right? And not reversing aging, but slowing it down, feeling your best. I've learned a lot also about hair preservation as well as skin preservation from her. So it's a nice partnership and tandem because there's a lot of similar questions that patients are asking, and hormone decline does have an impact on that, and hormone changes postpartum. postpartum, you lose your hair, you know,
hair,
that kind
skin.
of thing. Right?
Does she do full body aesthetics, or is it just focusing on the face, or?
Yes, mostly focusing on the face. You know, she is trained both in medical dermatology as well as aesthetic dermatology. So she also can do a mole check.
Oh, she can.
She can, absolutely. Yes.
Oh, that's good to know.
So it is nice to have that.
Wow, yeah.
And medical knowledge. I think there's been at least 3 times where one of my patients has a rash that I'm never seen before. I'm like, hold on, Jen, can you come here? So it's really nice to have that collaboration.
Well, the 3 of you, actually.
Amazing.
That's
a pretty nice.
So it's kind of rare thing, right?
Right. It kind of covers a nice with the range of, expertise and input.
Can you walk me through, if I want it to be a new patient, what that would look like? So
Sure.
call your office, and it's just concierge service. Then do you get access to the other 2? Like,
Great question.
How does this all work? Or do you sign up for each?
Maybe someday we'll have that.
Yes.
But yes, right now
the
we
platinum program.
Yes.
Right,
Yes.
exactly.
Yes.
We're
Yes.
work in progress.
Yes.
Right now,
Yes.
it is concierge. You wanted to see me per se.
Yes.
And by the way, I also have a nurse practitioner who's been with me for 19 years.
Yes.
Her name is Eileen Slipkoff. She's amazing. Women's health, specialized, was a labor and delivery nurse years ago. Has also a member of the Menopause Society and so forth. So she sees patients in a concierge model as well.
Oh,
She jokes that she's half price. Again, she's outstanding. So we offer that both with her and myself.
Okay.
And you can schedule for a one-time consultation to see if it's a good fit.
Okay.
If you have a specific problem, I tell patients I will give you my recommendation. I will tell you what I would prescribe. I will tell you what tests I would order. I will tell you how I would follow you. If they sign up for the year, then we'll go ahead and initiate that care.
Okay.
Okay. So at least if they want to just kind of get an idea, there's that opportunity as well. Okay. And same with Eileen. Dr. McConaughey, Doug, has separate concierge practice. Okay. Exact same thing. You can do the one-time visit for a consult, meet and greet type of thing. If that works, it's a fit, then you sign up for the year. That way we also can limit our membership.
Right.
You know, there's... the idea of being able to provide that quality and that time is to make sure you are available and that you're able to give that much time to the patient.
And then, but skin-wise is just anyone can call, make an appointment for the things that they want there.
And that's
right?
a really great and important point.
Okay.
In a sense, it is her own business. She has her own line. She has her own website, although you can link to it and request an appointment through my website as well. Okay. And she, you do not need to be a concierge patient of my practice to see her. And a lot of my patients choose to. You don't need to. And she also will see you for a consultation, which really I kind of recommend every woman do that. Because, you hear from your friend, try this, try this, and you go and find it. Yeah. But to have someone kind of say, here are all the things out here. And in the next 10 years, these are the products I'd recommend. These are the procedures I'd recommend. This is how frequently, I would recommend you use them to get what result you want. Because we all, know what's personal to us. If you then choose a treatment, she'll take that fee and apply it towards the service that you choose. So.
And I think we probably covered this, but just to be sure, I think that people know, yes, it is a concierge model that does utilize your PPO insurance when possible, but as part of that, you're still coming to you for your annual exams, getting the order for your mammogram and anything else that need the labs, like you said, all
labs,
that, right?
Exactly.
On the annual recurring.
Right. And then another thing that I think is really important is navigating your referrals too.
Right.
Being in practice here for 26 years, it's such a wonderful community. Docs do come and go and change, but there's a lot of, solid relationships you have with specialists and knowing what specialists or how to kind of get you into. So even navigating your referrals, whether it's a gastroenterologist, a urologist, a neurologist, and even navigating the home system. Should you go to the ER? Should you go to urgent care? Can we manage this here by giving you an IV and rehydrating you and some anti-nausea medicines and keep you out of the ER? Those are the things that we're able to do.
So we're going to be posting clips a little bit earlier than we had originally expected. So in January. So we want to make sure we talk about Pause to Action and your event.
Yes,
so
thank you so much. Absolutely. So one of my big passions, if it hasn't come across, is educating women. I've always said knowledge is power. I've been saying that to patients all 30 years I've practiced. And this platform I'm so passionate about too. So there is a woman named Kimberly Snyder who shares that same passion, and she actually has started a nonprofit organization, and I love the title. It's called Pause to Action.
Yeah, it's cute.
With the idea that you break the silence, educate, define clarity around this stage of life, and create community.
Right.
And as part of that, she's asked me if I would be open to putting together a curriculum for an event that really covers a broad expanse of topics. And I was really excited to do it because these kind of 1 hour little pieces don't really get that whole picture. So we are hosting an event. She is hosting an event that I am going to be the medical director of on January 28th at the Newport Beach Country Club.
Great
we
location.
are doing 2 sessions, 9 to 12 for moms that have kids that go off to school and they can make it in the morning, and a second event from 6 to 9 for your working moms, people who can't make it during the daytime. So it'll be the same
date.
Right, same date, same curriculum, same presenters, just 2 different events. We are going to have vendors, so you can actually learn about endometrial ablation, a way to get rid of heavy bleeding. You can learn about different products that are available. We are going to have allied professionals, so mental health specialists, acupuncture, chiropractor, physical therapists.
As vendors?
No, I kind of call them as allied professionals.
Okay,
The idea being that women being able to understand that you can create a support team depending on what you're struggling with, okay? And then the presenter panel is myself, which I will be teaching all things that are going to be coming. Don't worry, it'll end on a good note. And then we will move into the musculoskeletal system with my dear friend and orthopedist, Dr. Allison Estes. She's fantastic. Played soccer at Stanford, was doctor to the women's national team, and she is also in the stage of really wanting to help women understand how to preserve muscle, bone, and function. Dr. McConaughey will be presenting and talking about the neurologic health and cardiovascular health, which again, heart attacks, heart disease is the #1 causes of death among women. None of us seem to know that. I think it's really, really important. And so he's going to hit on that. Then we are going to talk about weight management, and that's going to be a whole series by Eileen Slivkoff, who actually directs our Get Slimly program. So not only why it's hard to lose weight, why you're gaining it, why it's hard to lose, but what things you can actionably do. And then Jen Mueller is going to present on both skin and hair changes that occur, and also practical things you can do. I will wrap it up with a discussion on hormone replacement therapy, and I will also talk about lifestyle interventions that are extremely important and tests that you should get done. And then attendants will be given basically a practical guide so that they can talk to their own clinician and be able to say, I would like to have these tests ordered, I would like to consider this, so they really have a tool kit that they can go with.
Comprehensive, for sure.
Yes, and that's why we're calling it a masterclass.
Yes. Oh, yeah, that's right. And where do people, it's a ticketed event.
Yes.
Where do people go to purchase those tickets?
So it's $135, and her link is, or the link to the event is both on my Instagram, right under link, or on Pause to Action Instagram, or on Pause to Action website. Right. And so it is limited. Please sign up sooner than later, and I really look forward to it being a fantastic educational opportunity.
Wonderful. Yeah, great. Well, let's get personal. Let's talk a little bit about Newport. You're a longtime resident here.
I'm going to take these off now since I'm in the shade.
Yeah. Although that we did have you. One of the questions was we have a UCLA, USC.
I went to both.
You went to both.
Oh,
so who do you root for in sports?
Well, I went to UCLA undergrad, which is where I met my husband. Okay. So, and then I went to USC for medical school. But at UCLA, I will always be a Bruin. But now that we're in the Big Ten, if UCLA is not in it, which has kind of been an issue lately, I will definitely root for SC.
Good to know. Yes.
And what are some of your favorite places to dine at here locally? Like something that people wouldn't be aware of, something that's been around a while.
Well, was mentioning when we were getting on the Duffy that we actually own a Duffy. And so we really get to know a lot of the restaurants that you can access by Duffy boat, you know?
Yes.
So I think that we tend to have some of those be our favorites. You know, we love going to the Cannery. We love going to Buddha's Favorite. Blue Water Grill, that little corner. You know, Woody's is fun because they'll bring you and serve you on your Duffy. So I don't really like going inside, but I like being served on the Duffy. And then we've been members of the Balboa Bay Club, and that's always a favorite.
I'm surprised you haven't seen
us. I know, I'm a member
Cross
there too.
paths.
Now we'll see each other all the time.
That's what happens. That's to recognize someone.
Exactly. And you're a very active family.
Yes.
You have 3 kids, 2 kids,
Three.
Yes. And what are some of your favorite things to do as a family when they're around?
Yeah, so I'm an empty nester now. They're 25, 23, and 20. But we are very active. We love hiking. We love going in the water, definitely scuba diving, snorkeling, and just exploring, traveling. So when I do get them, my middle lives in Oahu.
Oh, and you were just there.
And we were just there. She's working on a catamaran. She's got her master's in scuba. And she's also a Legree instructor. So all of us went to her Legree class.
Was it
so
tough,
you can't really sit for a day or two after.
I know. I've avoided it for that reason.
No, it's fantastic. It's a great workout. Yeah,
I've heard.
Fun.
Yeah, I saw that trip look like fun. And then your youngest is going to school.
He's at University of Oregon. Yes.
Oh, yes.
He's a junior there. So
you have to root for the Ducks a little bit.
Absolutely. I know. This is before the big game
coming up.
Big game on Friday. So I'll be wearing my green and yellow.
That's right.
Yeah.
How about favorite beach? I know everyone has a favorite street or a favorite.
Yeah, around here in
this
area.
Newport. What's your family go-to?
Right. So in Newport, our family go-to is basically 15th Street, that area. There's a house there that we did a rental at when the kids were younger, and we would do that in the summertime, and the friends would come, that type of thing. So, and it's just a big, expansive beach. So I'd say 15th Street.
So fun.
Yeah.
So fun.
Good question.
And then you can ask
my
your
favorite
question.
Okay.
I know you have a Duffy. So what is the Duffy's name? We just love hearing Duffy names on here.
Well, we bought it and didn't change the name. So it came with the name Volkswagen.
Oh, that's cute.
Super cute.
Super cute.
But if I could rename it, and I've always called it this, I would call it Liquid Prozac.
Oh, that's
cute.
That's my definite.
So can you not change names once they're named? Or
we just don't think it's good luck. Got
it. Don't want to risk.
Doctors are a little superstitious that way.
So, anything else that we haven't touched on that
I think we should
want
know
to close
about?
with? Yeah.
I think I'm honored to just have this interview.
Oh, we are very honored.
Yes, I was so excited.
You're busy and
when's she coming?
You're kind of famous around town.
Yes, you are.
Oh, you're kind to say that. I just think I've been around town a long time. And I really feel, I just want to say that I am so privileged to be able to practice medicine, to have the longevity of relationships with patients. Many that I've delivered are kind of circling back in this kind of midlife stage where now they can have that care. And that's just such a neat thing to see. I'm seeing some of these younger women who I actually delivered, and now I'm going off to college. So I really feel very privileged to be in Newport, to be in this community, to develop relationships. And we're not in LA, we're not in New York, we're not in DC, we don't have all the big glitzy conferences around menopause and things, but I'm excited to be bringing a little bit more to the women of Orange County.
Right.
And also to their spouses, right? So that everybody kind of learns together. So I just feel very privileged.
And when you say the spouses, do you mean more so they can learn what the women are going through and they can tolerate, try to learn to have some patience with them? Is that what you mean? Or,
Absolutely. In fact, one kind of a little teaser what's going to be coming. One of my friends and colleagues is a woman named Dr. Maria Sophocles. And Maria is a menopause expert, but also a really well-renowned women's sexual health expert. And she has a fantastic TED Talk that if you haven't listened to, I recommend. It's called The Bedroom Gap. And that's a term that she coined because as men age, it's very easy for them to, you can't watch a football game without seeing a Viagra or a Cialis commercial or him get this delivered to your door. We also have 32 forms of testosterone that are FDA approved for men. So they're getting their testosterone, they're getting their erectile dysfunction medication, complications, you know, and women are having a decline in their hormones, which can hit their libido. So we're like this,
Right.
hence the bedroom gap.
Right.
Her TED Talk's hilarious. She does a great job, but you know, it is such a big issue that isn't talked about much. And that's just one piece of how men being able to understand that perimenopause and menopause transition. But she is coming out with a documentary, and her book is being published and coming out in February. So we're going to host another event here in Orange County.
Like the Port Theater?
Something like that.
Similar-ish?
Yeah.
Okay.
We're finalizing the details now. So I'll
Busy
keep you
year,
posted on that. It's fun.
Yeah, I bet.
Yeah.
Well,
So bring your spouse to that one.
I think it'd be a good one.
Yeah.
Absolutely.
yeah, that's a good date night one. Huh?
Absolutely.
Yeah.
I think it could really help.
Yes.
So-
Well, thank you so much for joining us.
Thank
you know,
you.
again, we're honored.
Yes. Very much.
And I know people watching, it's, again, a topic that we hear about all the time, and we were both
Very
a little bit
excited.
different stages, but so of course we're hearing it all the time, and
Good.
we know that you love to educate, and more people need to learn, and from those that are trusted and care, and so thank you.
Thank
Thank
you.
you.
Thank you guys very much
Thank
for
you.
having me.
Thank
So.
you, Dr. Kroll.